feel like I'm just on Instagram all day today, or videos. How about that? I was just live in my private community, my Yes You Can Get Pregnant e-course community, which is for my members of that program. And then now here I am live with you guys. I'm really excited. And so this is going to be a live fertility Q&A where you guys can come on and ask me questions. The thing is, here are the rules, right? This is a live fertility Q&A. This is not a fertility hot seat. So don't ask to join me live. This is a live fertility Q&A. This is not a fertility hot seat. I will answer any fertility related questions. You have to put them in the question box though. So I will answer any fertility related questions, but you have to put them in the question box. It's that little circle with the question mark in your bottom right corner. Yeah, right. And I'll be on for like 15, 20 minutes. So let the questions start coming in and I'm going to answer them. Do not put questions in the feed because I'm going to miss them. Put questions in the question box and I will answer them. One thing I'll talk about before people start posting their questions is my Fertility Reboot, my most popular program. It's $150 or a two-pay option of $80 per month for 2 months. Kicks off next week on Monday. And we have the kickoff call on Sunday, but we kick off on Monday. Okay, so just so you know, I'm not going to answer any questions in the feed. You have to put them in the question box, and then I will answer them, okay? So please put questions in the question box. It's that little circle with the question mark, and then I will answer them. The Fertility Reboot, my most popular program. It's a 30-day fertility reboot. We basically do the first 30 days of the egg quality diet together because that's the hardest part of the diet. So you get support. And then we also, though, it's a mind-body transformation. We're not just doing diet. We're also focusing on emotional inflammation, as I like to call it. You're going to get daily emails. You get shopping lists, recipes, PDFs, all sorts of cheat sheets and stuff. It's awesome. Then you also get weekly group coaching calls with me where you pre-submit your questions and I dedicate my time to the mental emotional piece and how it relates to your journey and your questions. And there's homework assignments every day. One is focused on food and one is focused on feelings. And so I do a lot of the feelings work. And then Sarah, one of our Team Aimee coaches, she does a weekly group coaching call as well, focused on nutrition and diet. So same thing is happening. Last time I went live, it's like very low volume of people, which is not normal. I was saying I had this issue with my website and I don't know, it's so interesting how it's impacting the ability to go live. But I see some questions and I'll answer them. Okay, so there are questions in the stories that I'm still going through. So I'm going to answer your FSH at 43. So you have to remember 2 really important things. FSH and estrogen are inversely related. So if FSH is high, estrogen's low. You got to work on estrogen. Estrogen loves slowing down. Estrogen loves sleep. Estrogen loves nourishment. Estrogen loves like nutrient dense foods. Estrogen needs, in order to make proper estrogen, you need good gut health. So gut health is really important here. And then also FSH comes from the brain. Whereas AMH comes from the ovaries, right? FSH comes from the brain. So you have to think about mental emotional stress. You have to. It's a huge driver of high FSH. So those are my 2 recommendations there. And then is estrogen supplementation safe for someone who has had LAP stage 4? I'm confused. Ish, you know, I think I just put a filter on, right? Don't I look different all of a sudden? I don't know how I did that. Ish, it really depends on the case. I would need like more information on you, but endo loves estrogen, right? So estradiol I'd be careful with. I think ethanol estrogen is probably safer, but I would watch extra estrogen. It depends though. Sometimes they do that like right after a lap to help recover. It just really depends on the protocol and all the plan. So maybe I would put this in the ish category. I need more information on your case. Okay. Are heavy periods cause for concern or indicative of a problem? They can be. Changing pads every 1 to 2 hours. Yeah, that's a lot of blood loss. So I'm thinking about, do you have enough the rest of the month to mature follicles and to build up a lining? So it's a lot of blood loss. So you had endo-excision surgery. Do you have fibroids? Are there polyps? Has anyone done a hysteroscopy? I would probably look into the uterine environment. And then I'd also 100% be doing acupuncture and Chinese herbs because they can help so much with that. And then I'd also, of course, look into diet. So the fertility reboot that we're kicking off on Monday will be a huge, tremendous help to you. So yeah, they're a cause for concern to me. I want to make them less heavy, definitely. Okay, that question I already answered. And let's just see. Okay. Oh. What does someone with MTHFR and COMT need to be aware of with fertility? Estrogen metabolism and getting enough of the right kind of B vitamins. I'm the same. I have MTH and COMT, and I would like to call us sensitive Sallies. We're just super sensitive to any exogenous estrogens, any plastics, like the non-toxic bath, beauty, household stuff, you have to take really freaking seriously. Any exposures are just hard for your body, and you have to take methylation really seriously, which is our body's natural ability to basically detoxify, which I'm really generalizing there, but methylation is like billions of activities that happen in the body, enzymatic activities. All your B vitamins need to be methylated. You want to be careful with too much methylfolate, but not too little either. There's like a very fine line there. I have a really good MTHFR guide. You can just go to my website, aimeeraupp.com/MTHFR, and there's a guide on there with lots of information. That's a good starting point. I think there was more questions in here. Let me just see. No signs of polyps or fibroids or cysts in a saline sono. Nice trilaminar lining. Was thick per my December embryo didn't stick. I'm assuming if you're with Dr. Murphy, they did a hysteroscopy on you, right? So if not, I would urge a hysteroscopy before another transfer. Secondary to that, not every embryo transfer works, even if everything's perfect. I have a really good FET, like to prep for an embryo transfer list. You just go to aimeeraupp.com/FET, frozen embryo transfer. And it's good even if you're doing fresh, but there's lots of good tips on there. And that's the stuff I would look into of like, are you on baby aspirin? Do we need an antihistamine protocol? Did we do a hysteroscopy? Do we need more blood flow? Did you get acupuncture in the lead up? What's your diet like? What's your stress levels like? All of those things have to be taken into account. Okay. Just finding the questions. Okay. I have fibroids in my 40s, not yet trying to conceive. Can this help? Oh, this is a question, from Stories for the Reboot. Yes, the reboot will help with reducing inflammation, regulating the immune system, improving circulation and blood flow, helping you figure out the right fertility diet for you so that you're not freaking overwhelmed, because it's very overwhelming, this whole process. Reduce fibroid size, because anti-inflammatory is going to help with fibroid reduction. I would also make sure you're doing castor oil packs. I would make sure you're doing acupuncture and Chinese herbs. Those things are so important. And I see some questions in the feed. Do you mind bringing them to the question box, everybody? Because in the feed, I'm losing questions. So endometriosis testing question and the histamine question, please bring those to the question box and then I'll answer them. Thank you. Okay. What are the chances that a 1.4 cm uterine polyp can be the reason for multiple chemicals? I mean, if you have multiple chemicals and you came to me, I'd say get it out. Get it out. Do a hysteroscopy, get it out. Multiple chemical pregnancies too. Really look at my miscarriage panel, AimEeRaupp.com/miscarriage. But if you were in my office, first thing I'd be saying is a hysteroscopy. You got to get that thing out. It could be causing it. And then I'd also be looking at additional clotting factor issues. I'd be looking at inflammation overall. I'd be working with your diet, with your supplements, with your mindset. I'd be doing acupuncture, Chinese herbs, castor oil packs, all the things. Serapeptases. Join the Fertility Reboot. It'll help you. You're going to get a shit ton of information. And if you don't know about my Fertility Reboot, AimEeRaupp.com/Fertility Reboot. Enrollment closes tomorrow. And we are not accepting anyone coming in after enrollment. Okay. TSH 2.224, free T3, 3.3. T4 seems low, right? Anti-TG less than 15,000. Anti-TPO less than 28. You know, I was taught, like, you know, all the thyroid stuff I've done, like my continuing ed and studying with thyroid doctors or endocrinologists, we really want it below a 10, max a 20. When I see it above a 20, it's definite autoimmune activity going on. And so then I want you to be treating yourself like an autoimmune patient. Body Belief or the Egg Quality Diet are really good places to start. Okay, I don't see, let me just see. Is anybody, okay, there we go. Thank you guys for moving the questions over. It just helps me stay organized. What's the best practice for testing for endometriosis and endometritis without a lap? Hysteroscopy with endometrial biopsy. And so you would do the endometrial biopsy to test for the endometritis, which is the uterine lining infection. And then you would also do, it's called the Receptiva test. And it also requires an endometrial biopsy, and they send that off. It's a different test kit, but you can do it all in the same hysteroscopy. The one thing to keep in mind is the Receptiva test is only about 80% accurate. It tests for something called BCL6. And if it's present, it tells you have an 80% chance of having endometriosis. I also really like the Fertility microbiome and inflammation index. I use that now in my functional fertility group coaching program. And if your inflammation index comes up high, it's a very strong correlation with endometriosis as well. And then the microbiome part of the Fertility testing looks for the endometritis. And so we're using that, and that collects menstrual blood. You don't actually have to do a hysteroscopy with anesthesia. So that's another nice option. It is like a $600 test, but that's a really nice option. So Fertility, Fertilys. I love their testing. I'm a big fan. But can you speak about histamines and fertility? So I have a whole section in the Egg Quality Diet that speaks directly to this in the book, The Egg Quality Diet, which I don't feel like standing up and getting it, but you guys can find the book. I have Hashimoto's. Why is doctor putting me on a histamine protocol for an FET? Because it's considered, it's like a low-level autoimmune protocol. So the antihistamine protocol has, typically it's Zyrtec and Zantac or Claritin, and Pepsid, and then baby aspirin, and then a low-dose steroid, 5 to 10 milligrams of something like prednisone. People with autoimmune, which is the Hashimoto's, they have a higher likelihood of their immune system not accepting the embryo, or kind of like, right, half of the embryo is not you, right? It's sperm. And for some reason, in a lot of the population, the body just accepts it, carries on, even though it's not me, and my immune system should attack it, because anything that's not me, my immune system should kill. For some reason, and they still don't quite totally understand it, the body doesn't. But in some cases, autoimmune girls in particular, and I'll tell you right now, autoimmunity is a huge reason for most unexplained infertility cases. So I give your doctor a lot of credit. It'd be the first thing I'd recommend to you as well, especially if you have previous losses. But I'd also strongly urge something like my Fertility Reboot or by following my Egg Quality Diet. You really need an anti-inflammatory lifestyle across the board: nutrition, supplements, lifestyle, mindset. And yeah, if I had Hashimoto's and I was trying to get pregnant, I would 100% be on the antihistamine protocol. It just seems to lower that immune response just enough to you still need some immune response, and you still need some histamines in your body. We can't avoid histamines at all because they're everywhere, but we can lower the load, and then it allows for implantation. Okay, more questions here. Would you recommend red light therapy to help increase egg quality? I just had a conversation about this with my good buddy, Mark Sklar. Red light therapy is not going to hurt anything. It's warming. It improves circulation and blood flow. Same as acupuncture, same as castor oil packs. But red light therapy is not the same as laser. There's a lot of people out there saying, do red light, like even, I think his name is Red Light Man or something like that. He's got a website. There was a study, I don't know, 5-10 years ago. Oshiro, it's a Japanese study. They used a laser, not red light. And they restored ovarian function they weren't even trying to help fertility. They were helping women with pain, but some of these women were in menopause and their cycles came back. They started ovulating. Then they did another study just on women with, what did they call it? I forget what the word is, but it was a terrible word of like really intense infertility. So it was like 8+ years of infertility. And it was something like 70% of these women started getting pregnant. It was insane. They used an actual laser. Lasers penetrate centimeters in the body. The red light therapy penetrates millimeters. So red light therapy is not the same as laser, and it will not do what the laser does. You have to find someone who actually has like the Giga laser or something like that. These are like $50,000 units. There's some better like at home ones coming out, but they're still thousands of dollars, not these, Salumas and things like that, or the Juve that are a couple $100. So in my opinion, it's fine to use. I'm not against using them. I think there's other places to spend your money that could be just as effective, as particularly castor oil packs, mind abdominal massage, Avrigo, pelvic floor PT, acupuncture, Chinese herbs. These things are gonna, I think, from a clinical perspective, give you more bang for your buck. There's no harm in red light therapy, but the claim that red light's going to improve egg quality is not founded. There's no science there. And people are quoting the Oshiro study, which was a laser. So just really kind of check the resource there. Again, I don't think red light therapy is harmful. A lot of my girls are doing it. Fine. If you have the extra money and you want to spend it, totally do it. I sit on this like infrared mat all day long with stones in it. I kind of just love it. It keeps me warm and, circulating things. It was $150. Totally. If I had a knee injury, I did the red light therapy on my knee. But again, I also did castor oil. I also did acupuncture, Chinese herbs, right? So there's lots of ways to get but egg quality also, like you want to improve mitochondrial function and cellular function, and that is going to come from lifestyle shifts. You can't just do red light therapy and take supplements and think your egg quality is going to improve. You have to do all the things. Because it's hard. You're fighting an uphill battle when you're trying to improve egg quality. And so you want to come at it from every angle. And let's see. Okay, histamines. Okay, let's see. I feel like I skipped a question. Sorry, let me just look here. Oh, no, I think I got all the questions. I have more questions and stories from my question box. Oh, here. This is the question I almost missed. Is myo-inositol good for IVF? I've had 2 failed IVFs, and the doctor told me to stop taking it. I'm 42, 5 years trying to conceive. What are the best supplements to take? I'm actually reading your book, and the Egg Quality Diet, starting second phase. All of my supplements are on my website, AimEe'Raupp.com/fertility supplements. It's hard to say. I don't know enough about your case. I would also look at my FET check sheet checklist, AimEe'Raupp.com/FET, frozen embryo transfer, and do all the things on there. I would make sure you have done a hysteroscopy, do acupuncture. A myo-inositol typically isn't making or breaking an embryo transfer. myo-inositol is good for egg quality. There's research behind that. It's also good for women with insulin resistance, PCOS. But it can lower AMH and some androgens in some women who don't need it. So I always am checking androgen levels. I'm keeping in mind the whole case when I'm making the recommendation for myo-inositol. Not every one of my girls is on it. But there's lots of reasons why the transfers aren't taking, and I don't think myo-inositol is the one and only reason. And I wouldn't consider it like the thing that's causing it to not work. I would really look at uterine microbiome. I would look at the uterine cavity. I would look at inflammation in your body. I would try baby aspirin with a transfer, the antihistamine protocol that we just talked about. Look at my FET checklist. It has everything on there that I've just vomited out. AimEeRaupp.com/FET for frozen embryo transfer. Okay, there's one question I'm going to answer, and then I'm going to go, because I got a lot in the hopper today, as my husband would say. Do you think LASIK facialis can affect egg quality? I don't know what LASIK facialis is. I'm going to make an assumption that it's some kind of skin condition. LASIK facials. That's what you're asking. My God, I'm like Latinizing the whole word. Can affect egg quality? No. I probably wouldn't do it in the 2-week wait, but no. That is so funny, right? Thank you for laughing with me. I'm going to answer this question in the feed, and then I'm going to go. I love you guys. What's the optimal estrogen and progesterone on day 3 of the cycle? Progesterone should not be really present at all. Should be below a 1 or at a 1, max a 2. But it's low. It's usually like 0.4. And estrogen on day 3 should be between a 50 and an 80, I think, nanograms per milliliter. All of that's in my books. Okay, and last push, the Fertility Reboot, my most popular 30-day program, kicks off on Monday. Enrollment closes tomorrow. Don't miss out. It is an amazing program for a really low price point. You get so much. It's a great way to jumpstart your fertility. Even if you can't totally follow the diet, just tune in. You're going to learn a shit ton. You're going to get so many free resources. Well, resources that come with the program that you paid $150 for. You get weekly group coaching calls with me, weekly group coaching calls with Sarah from Team Aimee. You get video lessons. You get daily emails. I mean, the whole kabang. AimEeRaupp.com/fertility reboot. And yeah, okay. It was fun to be here. I haven't been here in a while, and it was really nice to be back. Love you guys.